The Strange Situation as a psychological experiment by Mary Ainsworth to observe attachment relationships between a caregiver and child. The procedure involves a series of 8 episodes lasting approximately 3 minutes each, whereby a mother, child, and stranger are introduced, separated, and reunited. During episode 1, the mother, accompanied by an observer, carried the baby into the room, and then the observer left. This episode lasts less than 1 minute. During episode 2, the mother places the baby in a designated area, then sits quietly, only interacting if the baby initiates. This episode lasts for 3 minutes. During episode 3, the stranger enters the room, sitting silently for a minute, then conversing with the mother for another minute before gradually approaching the baby with a toy. After the 3rd minute, the mother discreetly exits the room. During episode 4, the stranger didn't intervene if the baby was contentedly playing. If the baby was inactive, the stranger attempted to engage him with the toys. If the baby was upset, the stranger sought to distract or soothe him. The episode was cut short if comfort couldn't be provided, otherwise, it continued for 3 minutes. During episode 5, the mother enters and momentarily pauses at the doorway, allowing the baby to react to her presence spontaneously. The stranger discreetly exited. The subsequent actions of the mother were not predetermined, except for instructions that once the baby resumed playing with toys, she would leave again, pausing to say bye-bye. The duration of this episode wasn't fixed. During episode 6, the baby was left by themselves for 3 minutes, unless their distress level necessitated shortening this time frame. During episode 7, the stranger returned, acting as in the 4th episode for 3 minutes, unless the baby's distress led to a premature ending. During episode 8, the mother comes back, the stranger exits, and once the mother-child reunion is noted, the scenario is concluded. The child's reactions to the caregiver's departure and return are observed to classify the attachment as secure, insecure avoidant, or insecure resistant. Infants with secure attachment feel confident that the attachment figure will meet their needs. They use this figure as a safe base to explore their environment and seek comfort from them in times of distress. Infants with avoidant attachment are highly independent of their attachment figure, both physically and emotionally. These insecurely avoidant children do not orient themselves towards their attachment figure while exploring their environment. Children with resistant attachment tend to cling to their mother in unfamiliar situations and show reluctance to explore. They experience extreme distress when their mother leaves them alone, exhibiting separation anxiety, and they are fearful of strangers. Upon their mother's return, they express happiness and seek her comfort, but they remain inconsolable and may display signs of anger towards her. In this scenario, children adopt an ambivalent behavioral style towards their attachment figure. They often exhibit clingy and dependent behavior, yet reject the attachment figure during interactions. Sensitive mothers are more likely to have securely attached children. In contrast, mothers who are less sensitive towards their child, for example, those who respond to the child's needs incorrectly, or who are impatient, or ignore the child, are likely to have insecurely attached children. Mary Ainsworth's finding provided the first empirical evidence for John Bowlby's theory of internal working models of attachment relationships.